all eye diseases are treatable in Ayurveda. That is the truth. But before selecting a patient for treatment, I will advise to take two factors into consideration. First is whether the medicines and facilities are readily available in our hand for that particular case. That is the first criteria for selection. Second is whether Ayurveda is the best option for that patient. These are the two things we have to consider before taking a patient. This is applicable not only in eye disease, for any disease, any stage like that. Sometimes we will say, oh, this is treatable in Ayurveda, but oh, what can I do? There is no medicine available in my hand and there is no facilities for that. Like that will come. Then don't take. Be prepared for that, because I will always say patient deserves the best. He has the right to get the best treatment and best option. For that we have to give them the chance, not drag him to some wrong sides. So if I can give him the best treatment, then whatever it may be, whatever disease it may be, I will take. If there are facilities and medicine for that particular condition, for particular person, then I will take that case. That is my decision. But generally speaking, we can say there are some diseases in which Ayurveda is the best option, because there are many conditions I have seen in allopathy. They have to wait to have some indications. For example, in myopia, degenerative myopia, progressive type of myopia is there. Then it will be starting by the age of 5 years or 10 years, like that, in a young age. But the best option always prescribed by an allopathic doctor is LASIK. And they have to wait up to the age of 19 years to get it done. So, is it a best option to wait up to 19 years to get a treatment? I think no. So, at that time I will think whether Ayurveda can do something better. Then the answer is yes, there are methods in Ayurveda to protect that eyes from being worse by the age of 19 years, or we can solve that problem. That type of conditions I will take over. Then there are some things I have seen patients saying, he is a diabetic patient and he is advised to have checkup monthly. And then he says there is no problem. And one fine morning, they are advised to get laser immediately, or there is hemorrhage, there is retinopathy. You have to undergo the intraocular injection or laser or surgery immediately, otherwise your vision will be lost. Then that means there was a possibility for that, and they can do some measures or some curative steps when it develops. In such a condition, the patient, the same thing, patient deserves the best. The patient had to prevent it. In such conditions, anyway, it is the responsibility of any doctor to prevent the development of such a serious situation. Such conditions are easily manageable in Ayurveda. There are methods to prevent from being developed in a serious situation. These two situations are highly considerable nowadays. Then comes the actual disease. These are all disease itself, and some degenerative type of conditions. Even now it is beyond all the modern technologies and medicines like that. But by a basic level or scientific level Ayurvedic approach, it is manageable. Mainly, I have already told various types of degenerations and some deficient type disorders. These are manageable in Ayurveda, and very good results also are there. Such conditions I will give preference. I will always advise my juniors and also my students to take over these types of conditions and protect them from being blind. These are avoidable blindness. we can protect them, of course. So it is our responsibility, not the profession, but our responsibility to intervene, to take some measures so that that person can live a good life.